Hello and welcome to the Multicultural Media Online Conference hosted by the Ministry of Health, New South Wales Multicultural Health Communication Service and Multicultural New South Wales. I'm your moderator today. I'm Jesusa Helaratne, Deputy Director of the Multicultural Health Communication Service, and it's such a pleasure to see you online with us again today. The Minister for Multiculturalism, the Honourable Mark Curé, sends his apologies as he's unable to join us for this session, but we have still Dr. Jan Fizzell, our Senior Medical Advisor, to give you updates on COVID and answer your questions. But today we also are we're so pleased and happy to have a special guest with us. We have Dr. Britton. He is a Paediatric Infectious Diseases physician and early career researcher based at the Children's Hospital at Westmead. And we're so happy he's able to join us to talk about keeping young children safe in relation to COVID-19. So please ask your questions on the chat and we'll make sure that Dr. Jan and Dr. Britton is able to answer them. We'd like to begin by acknowledging the traditional owners of the land from which we are all meeting from today. We pay respects to elders past and present and also emerging, and we pay respects to multicultural communities and elders and leaders who are represented in this session today. For Dr. Jan and myself, we'd like to acknowledge the traditional owners, the Camaragal people of the Guringai Nation, of the Eora Nation. So would like to acknowledge them, and also would like to please ask you if you can please add on to the chat, put your name, and also let us know where you're joining from today. Throughout the session, my colleagues from Multicultural New South Wales and the Multicultural Health Communication Service will be putting links to help you find resources in languages regarding COVID-19, and especially some videos and booster and vaccination messages. So shall we start? We have Dr. Jan Fizzell and Dr. Britton. Dr. Jan Fizzell, any updates?
Yes, so today we're reporting just over 24,000 positive cases in New South Wales. The important thing is to note that we are seeing an upswing in cases, and so we are asking the community to be particularly mindful. Whilst we're pleased to know that 95% of people aged 16 and over have received a first dose of a COVID vaccine, and 94.5% of people have had a second dose, of people aged 16 plus, 62.5% of people who could have had a booster dose have taken up that opportunity. So please, we are asking you to encourage the community to have that extra dose of vaccine to improve protection, particularly against the Omicron strain. Of children aged 12 to 15, 83.5% have had their first dose of a COVID-19 vaccine, and 79.3% have had 2 doses. Of children aged 5 to 11, 48.9% have received a first dose of a COVID-19 vaccine, and 18.4% have received 2 doses. So it is important to keep encouraging families to come forward for vaccination. We do have our New South Wales Health vaccination clinics, and you can find a vaccination clinic by going to the New South Wales Government website. Sadly, today we're reporting the deaths of 5 people with COVID-19, 3 women and 2 men. All 5 people had received 3 doses of COVID-19 vaccine, and we express our sincere condolences to their loved ones. This does bring the total number of COVID-related reported deaths since the beginning of the pandemic to 2,036. Thanks, Jess.
Thank you so much, Dr. Jan, for those updates, and those numbers are, it's important for us to know that they're high, but we have to keep everyone safe, isn't it?
I think this is the important thing. We are seeing that increase, and most of us who are in the community at the moment will know of parents of school children who've been told about cases at school. They may have been impacted with their family having not caught it over the Christmas New Year period when we had that higher uptake. So please, we are asking people to be particularly vigilant. We know that this is a time of year when families are starting to plan on getting together for special events or getting ready to go on holidays. So please, if you have got a notification from school or from work that somebody has COVID, before you get together in a large family outing, before you get together for visiting an older person in your family, do think about using a rapid antigen test just to screen to make sure that you're not taking COVID with you to that celebration.
Thank you so much, Dr. Jan. And as we said, we have Dr. Britton here with us. Hello, how are you, Dr. Britton?
Good, thanks very much. It's great to be here and join you guys today.
We have the question for you. Why do children need to be vaccinated? And if they don't get sick or have any symptoms? And I think that's a question that people are asking.
Yeah, and look, it's a good question. It's true that on average, children are much less likely to become unwell with COVID than adults. And so we've done some analyses and it looks like 1% or less of children who get COVID need to go to hospital. But if you think about the sheer number of children who are getting infected, that's still a reasonable number of children. And we know that vaccination does reduce your risk of needing to go to hospital. So even though a great majority of children are going to do very well with COVID, we know we can drive down the number who need to go to hospital. And on top of that, a very small number of children can get very sick, particularly those with other medical conditions. And so getting vaccination to those children and all children both reduces their risk of ending up in hospital and will also help drive down the total number of infections in the community.
Thank you so much, Dr. Britton. And I guess that question goes to going to schools and centers for children. Dr. Jan, the question here is people, the organizations or schools are struggling to deal with the spiraling COVID-19 cases. How do New South Wales Health and how does the government or schools deal with a situation like this?
Look, I think the first thing is that they're trying to communicate with parents the importance of not sending your child to school if they're sick. So if your child has any symptoms whatsoever, hopefully you still have some of those free tests that the government distributed to households, and that's a perfect time to use those tests. If not, do consider taking your child for a PCR test if you don't have a rapid antigen test available. It is important, though, that even if that test is negative and even if the PCR is negative, we've got other infectious diseases circulating at the moment. So please, if your child's not well, have a very low threshold for keeping them home rather than sending them to school. Schools are notifying people who've had contact with cases. Schools are paying attention to the ventilation. Schools are, wherever the weather allows, encouraging outdoor activities. But it's also the other things that children do outside of schools, which is where COVID can happen. So again, if your child's been unwell and stayed home from school for the day, please don't send them off to sport or to Cubs or to whatever else they might be doing in the community. It is important that we try and keep our germs to ourselves this winter.
Thank you so much, Dr. Jan. Dr. Britton, the question here is, why are there still no available COVID-19 vaccination approved for use for children under the age of 5 in Australia? And how do we keep our children safe?
Yeah, so there is no vaccine that's been proven efficacious for children under 5. And as a result, it's not been brought to our authorities in Australia who oversee the registration and then the recommendation for vaccination. So that's really the fundamental answer. There really isn't a vaccine that's proven safe and effective for children under 5 yet. We will be a country that gets in line as quickly as possible as there is one, but there isn't one. With respect to how can we then protect children under 5, well, it falls back on both the rest of the community to get vaccinated to reduce transmission, but also then to embrace those other things that Dr. Jan was also just speaking about. Enhanced hygiene, hand hygiene is still important. Consider wearing a mask when you're in indoor locations. There's no mandates in place and that's appropriate, but consider doing it where you can and it's appropriate. Young children, that's difficult, we understand, but if adults and older children will wear it, that'll reduce transmission. Use those RAT tests when you can. If you have symptoms or if it's before some sort of larger gathering, there's an opportunity to detect infections early and hopefully then not transmit them on. And where we can do things outside in well-ventilated places, have gatherings in those locations, we know that also will contribute to a reduced risk of transmission to children. So we do have those tools. We've all embraced them for a couple of years now. Let's not stop using them because there isn't a vaccine available. Let's really maximise those other tools to prevent infection in young children.
think, Dr. Britton, you're right. We're in saying let's maximize them. Let's not forget them to keep our community safe and our children. Dr. Jan, there's a question on from our audience. Why are we seeing another wave of Omicron?
Look, I think what we know is that we've now got a even more contagious variant, sublineage of Omicron, if you want to use the technical word, that can spread even more easily. And there were a number of people who were fortunate enough not to be impacted over the Christmas New Year period. We've also had this incredible period of poor weather where people haven't been able to get outdoors. Kids have been stuck indoors at play. Kids have been stuck indoors the rest of the time. So I think what we are seeing is a more transmissible form of COVID at the same time as we've had a whole lot of people stuck indoors for a very long time. So what we need to do, though, is remember that what we did for Delta, what we need for Omicron are the same things that will help us with this current situation. And again, those things that we've all talked about, we all know how to do, we just keep doing them. And I know some of us are really tired, and I know, the mask, I've got to make sure I've got my mask, and, but if it keeps me safe, or by me wearing a mask, I keep other people safe, then it's not a high price to pay.
Thank you so much, Dr. Jan. And then for those who are children who do have had COVID, a question here is, what are the long-term effects of vaccine on young people? And is there any research being done to inform us of this safety, just to make sure that the kids are protected? Dr. Britton.
Yeah, look, it's a great question, and I know this is on many people's minds. The fundamental answer is that the vaccine is safe in children for whom it's eligible. In fact, there's been a huge data collection called OzVac Safety. People can Google that, OzVac Safety, looking for side effects after vaccination. And it's very clear that the side effects of the vaccine for children and young people occur less frequently in children than they do in adults. So even those relatively mild acute side effects, even less frequent in children. With respect to serious side effects, we've got excellent safety monitoring mechanisms in Australia, and the TGA monitors any reports from doctors around any events that might be associated with vaccine receipt, and we are not seeing any signals of serious safety issues in children in this country. And so I think parents should really be assured this is a safe vaccine for children. And so the benefits of getting vaccinated in terms of preventing disease, preventing in your child, and also preventing transmission of the virus in the community are clearly in favour of getting vaccinated. And the side effects, where they're present, are mild and short-lived.
I guess a follow-up here. Would the COVID-19 vaccination change, there's a question, the child's DNA and affect their fertility?
Yeah, look, again, there's been a lot of information circling in social media about this question. And I think it comes from people hearing that the vaccine, the Pfizer and the Moderna vaccines for children, they're based on RNA. And so people hear that and they think, what, are you doing something to my child's DNA? And if I can just take a moment, I think it's helpful to explain this clearly. The way our cells work in our body is we take the DNA, which is like the blueprint in the cells, that is shifted to an intermediary kind of molecule, RNA, and then that is what's used to make proteins, which are the structural building blocks. That direction of information is one way, DNA to RNA to protein. The vaccine that we give is an RNA vaccine. It then gets made into the proteins to stimulate our immune system, but it doesn't go the other way. The RNA doesn't go to DNA. It doesn't affect the basic blueprint in our cells. So people don't have to worry that this RNA is somehow changing our cells or the blueprint of our bodies in DNA. It just doesn't move in that direction. That's a key comment. And that then also speaks to the issue of fertility, because people then said, well, what about the DNA in terms of my ovaries, or in men, their testicles? Could this somehow affect reproduction? Firstly, there's no good reason, biological reason why that would happen because of this DNA to RNA to protein pathway. But as well as that, people have studied fertility in women after vaccination. They've studied birth rates in countries with widespread vaccination. They've looked at whether this vaccine can affect fertility in animals, which is a well-established way of understanding safety of therapeutics. None of those different types of studies have suggested any effect on fertility. And that is so important that we dispel that myth. There is no evidence at all that these vaccines affect fertility or future fertility.
Thank you so much for that explanation. And that, I guess, that answers questions for not just children, but also for adults.
Yeah, and what we do know is that for adults planning pregnancy, getting vaccinated really can also help protect you as a pregnant person, because as your pregnancy progresses, if you get COVID, you're at higher risk of complications, but it also helps protect your baby. So getting vaccinated, no matter, what stage of the life cycle, is a really important way that we can protect not just ourselves but others, and if we are planning a family, protect our babies to be.
Thank you, Dr. Jan and Dr. Britton. There is an impression in the community that COVID-19 is similar to the winter flu. What are the similarities and differences between the flu and COVID-19, and is it possible for a person to be both infected by COVID and the flu concurrently? And just a reminder to our audiences and the people online, please do add your questions, because it's really important that we ask these questions for our experts here. So Dr. Jan, is there any similarities, or could you both have COVID and the flu at the same time?
Yeah, so they're caused by quite different viruses, but our bodies have only got so many ways they can respond to viruses. And one of those ways is to make us feel, hot and cold, give us the body aches and pains, the runny nose, the sore throat. Now, flu and COVID can do both. COVID and flu can both do a cough. I'll let Dr. Britton talk about flu and COVID in children, but definitely for adults, they can both cause quite serious illness. Even, young, fit, healthy people can also wind up in intensive care with influenza. More likely to happen with COVID than flu, but still, flu's not a nice virus to go meeting on a dark corner at night. So again, the things that we do though that help prevent COVID have helped prevent flu spread for the last 2 years. And I think that's something that we need to remember, that wearing a mask, the hand hygiene, being vaccinated, got our flu levels down to absolute record lows. And so the things that help prevent COVID also help prevent flu. But really important messages about keeping kids safe. And I'll let Dr. Britton talk about that.
Yeah, so there have been some very unusual and cases where people have had the COVID virus and the flu virus at the same time. They're few and far between, not really in Australia. In children, the symptoms that you get with flu and COVID absolutely do overlap. The runny nose, the cough, the fever, the diarrhea, the vomiting, the tummy pains, all of that can overlap. And that will make it difficult. And that does speak to the need for considering vaccination for flu, as well as vaccination for COVID. And we know the flu vaccine is available for children under 5 and is funded for children under 5 as well in New South Wales. So people should really embrace that opportunity, I think, this year. With respect to other things that we can do to prevent those infections, I totally endorse what Dr. Jan has said. We have seen record low flu for 2 years now. What we don't want to do is go back to behaviours that promoted flu transmission during winter. We really want to take all those things that we've learned from COVID and really continue to use them and protect ourselves against a multiplicity of infections, and flu is one of them.
Thank you, Dr. Britton. And a question here on the chat is, how long after getting COVID should one wait for the flu shot?
So once you're recovered and released from isolation, you can get that flu vaccination, and the flu vaccines will be available in in April. So definitely worthwhile either making an appointment with your doctor. They'll be available at pharmacies. It is really important that we embrace flu vaccination this winter. We're not sure what the flu season will look like, but for a lot of people who have been vulnerable to the effects of COVID, they're also vulnerable for flu, and it is funded for adults with a chronic disease and for people over certain ages. So please do talk to your GP, book in for those flu shots when they're available.
Thank you, Dr. Jan. Dr. Britton, a question here. Some people believe that if their child has already had COVID, that they have natural immunity and don't need vaccination. Is this the case?
Well, the answer is yes and no. So when children get the COVID infection, they do get an immune response. We know that that's been studied around the world. But some aspects of that immune response will protect them for a period of time. But it happens to be that in younger children in particular, part of their immune response to the infection is not as activated as it is in adults. And that predisposes them to then maybe getting reinfected over time. Now, not all of the data is in on this. Not all of the science has been resolved. But the signal is that vaccine promotes a more effective memory immune response to the virus than the infection alone. And so we would absolutely suggest, even if you've had the COVID infection, take the opportunity to get vaccinated. There's no particular concern for getting vaccinated after infection from a safety point of view. It's the same as if you hadn't had the infection. But we know that from the point of view of your immune system's memory and future responses to the virus, there's an added benefit from vaccination over infection alone. And that's particularly evident in children.
Dr. Britton, I guess that question of having further vaccines and boosters, given the new emerging variants, we've had 2 doses, 3 doses now for some of us, and available boosters for 16 to 11 years old, and also for other people. What can we expect with emerging variants? Is there going to be a 4th booster or another vaccine?
So for people who are immunocompromised, who had 3 doses as part of their primary course, they are being offered a 4th dose at the moment. And our technical advisory group on immunisation is looking at the evidence from around the world, from countries where they have brought in an additional booster dose, and looking at the epidemiology of what's happening here. So how the disease is moving through our community here. And they'll make a recommendation to the community about whether a 4th dose is necessary or not. I think we're learning more and more about the long-term immunity that the vaccines give us. And so we've still got a lot to learn. I don't think anyone says we know everything at this point, and anyone who says never ever, I think we've all learned that COVID doesn't believe in never ever. So I think we just need to keep an open mind. And I think that's the important thing, that you don't want your doctor to run off information that's 2 years old. You wouldn't want your doctor to not give you the latest treatments if you had something else going on in your life. And so I think while we have good evidence with good information, with people who are expert evaluating that information, we should take their advice. And I think that's what my recommendation is. We wait, we see what our experts say for the Australian context, noticing that, in Australia, unlike a lot of countries overseas, we're quite late to the many people having had COVID party, but also quite early to a highly vaccinated community party. So I think we've really got an interesting path ahead of us, and we'll all listen and learn as we go. I don't know if Dr. Britton's got anything more that he might like to add.
No, just to really endorse what you've said, Dr. Jan, which is that the pathways for the evaluation of vaccine use in this country are as good as anywhere in the world. And both our regulator that registers vaccines for use and our specialist bodies, you will have heard of ATAGI, that give this particular recommendations for their use in different people and at different times. This is a very robust, tried and true process in this country. And I absolutely endorse the view that we should wait and listen to their advice, because it will be the best advice for Australians.
Thank you, Dr. Britton. A question here on the chat is whether booster shot always going to be the same strength as a full third dose?
So my understanding is that depending on which vaccine you're having, you may either have the same dose or half the dose. So what will happen is when you go to the vaccination clinic, you will have booked in and they'll give you the dose appropriate for the vaccine you're receiving. I think that's the key thing. The studies are being done and we have different recommendations for the different vaccines. And so you'll get what you are recommended to have.
Thank you. A question that's come up. Why can't people under 5 be given a vaccination off-label? Dr. Britton.
Yeah, we'd really caution against going down that pathway. We do know that with this particular infection, age is very important in the risk of the infection overall, which suggests that age is very important then for how we use vaccines, okay? So we really want direct evidence of safety and effectiveness in the age group before we go about using those vaccines. And as I mentioned earlier, the studies and the regulators have not approved vaccines for this age group. So I would strongly caution against anyone using it off-label for children. There could be risks that we haven't been able to evaluate yet. And so as a result, though you might think, geez, this makes sense, this is going to protect them, I would strongly caution against using it in children under 5 until it's both registered and recommended for that age group.
You said, Dr. Britton, that's why there's these regulations or why it's coming out of 5 to 11 or 16 to 17. There's research that supports those messaging.
That's right, absolutely.
Dr. Jan, a question here is about isolation. If you've isolated once, then a family member gets COVID, do you isolate again?
So this one's always a tricky one. If you have got COVID, you need to isolate for 7 days. Anyone else in your household has to isolate for 7 days. Assuming no one else gets COVID, everyone leaves at the end of that 7-day period. If somebody else in the family gets COVID, that person has to isolate from 7 days from the day they start. But in consideration of the disruption that isolation has got on family life, the government has determined that people only have to isolate for that first 7 days if they're in that household, and then they can start going about their business. But our health advice would be to be very, very cautious, to make sure that you're really aware for 2 weeks after you've had a good exposure to someone with COVID, because the incubation period for COVID is still 14 days. And so you want to be particularly careful for 2 weeks after you've had a significant exposure to someone with COVID. The next thing that can happen is that person with COVID recovers and gets exposed to someone with COVID again. At the moment, they don't need to re-isolate, and in our self-isolation order, that's a period of 8 weeks, but there's a national recommendation for that to move to 12 weeks. And so as our process is up to date, it'll probably be, you've had COVID for the next 12 weeks, you don't have to retest or re-isolate. If you have a really heavy exposure and the rest of your family has got COVID and you become unwell, we certainly recommend you talk to your doctor though about whether you should get tested or not, because it could have things to do with your immunity. It could have all sorts of other reasons why something might happen. Generally speaking, it'll be a 12-week period after you're released from isolation from having had COVID before you have to isolate again.
Thank you, Dr. Jan. Dr. Britton, a question about children, where can COVID, a lot of people don't want to be isolating because if a child has COVID, then they might not be, it's not as strong as to get infected by it. This is a child. Is there truth to that? That the child doesn't pass COVID on?
Yeah, look, I think it's fair to say that the evidence is mixed on that. With prior strains where the rate of infection in children, generally speaking, was a bit lower than older age groups, there did appear to be a lower transmission rate from children both in the school environment and even in the household. Now that with Omicron, we're seeing a larger number and a higher proportion of infections in children, that reduced transmission risk is not as evident. So I think it doesn't really matter what the age of the person is infected in your household. You still have to follow those rules around isolation that Dr. Jan's just been through with us.
Dr. Britton, a question here from the chat. The sudden death of a popular cricket player appeared to start the conversation that COVID-19 may increase the risk of heart disease. How much is there truth in this narrative?
So something that we've seen from studies overseas is in the 12 months after having recovered from COVID-19, there has been an increased risk of heart disease, mostly around people having an acute myocardial infarction, or what people often call a heart attack. We're still trying to understand that. We also know that during acute infection with COVID-19, your blood is more likely to clot, so people could sometimes have strokes and other issues with clots in their bodies. So COVID's really not a nice virus to get. We're still learning about what happens after you've had COVID, and we're still looking to see sometimes once we start looking for something more commonly, we'll see it more commonly. So for example, we've seen just in recent days reports that there's an increase in diabetes mellitus after COVID. Now the question might be, have there been people who would normally not have come into contact with the healthcare system who have their diabetes diagnosed because they've had an increased contact with the healthcare system because of COVID? So there's things that we need to unpick, but I think what it just shows is that we're still learning about it, but certainly it is something that has been mentioned and is important, so that, you know, if people have got chest pain, having trouble breathing, it is really important that they don't just sit on those symptoms and do get checked out.
Dr. Britton, is this the same case for children?
So the cardiovascular disease, so the clots, stroke, heart disease, we don't see that same risk in children. However, people online today might have heard that there is a post-infection inflammatory disorder in children that is not really seen in adults. It's variably called multisystem inflammatory syndrome, or in Australia and the UK, PIMS-TS, or Paediatric Inflammatory Multisystem Syndrome. It's actually uncommon. We've been doing surveillance for this condition in Australia since early on in the pandemic. It looks like it happens in about the order of 1 in every 2,500 to 3,000 children with infection, but it does occur. And so in about the 4 to 6 weeks after COVID, if your child were to have a fever that's lasting more than 3 days, a rash, or being unwell with vomiting and diarrhea, you should absolutely take your child to see their doctor and to be assessed. So it's not common, but when it happens, it's significant and does require treatment in most children. And again, the emerging evidence from overseas is that vaccination, by reducing the risk of infection, also prevents this. So again, another reason to think about getting vaccinated, and the peak age group for this problem is children aged 5 to 11, which is an age group where the vaccine is available and recommended at the moment. So we strongly recommend it.
Thank you so much, Dr. Britton. And we've run out of time, but, you know, it was really engaging and very informative session today. Dr. Jan, any last words for the people online?
Look, just again, thank you everyone for all the effort that you've made. Keep looking after each other. I know that whenever we have a surge of infection, there's a whole lot of people who become very anxious and really concerned. Do review your family's COVID safety plan so that you're not stuck at home without the paracetamol or things that you might need, so that you've got your week's worth of stuff if you need it, if you can. Do make sure that you're encouraging family members to get vaccinated and tested. If they do a rapid antigen test, get a positive result, do assist them in registering those results so that we can link them to care. And please, of course, keep looking after each other, and thank you for the amazing work you've been doing.
Thank you so much, Dr. Jan. Dr. Philip Britton, it's such a pleasure to have you here with us. Any last words for the people online?
Flu vaccine, COVID vaccine, both worth thinking about and getting around to doing, particularly for your kids.
Thank you so much, Dr. Britton and Dr. Jan. And you said AUSVAX safety. That's where we should be looking at.
So AUSVAX safety. Google that. It's a great website, and you can look up the latest data on safety of these vaccines in children and adults.
Thank you so much. And that is it for our session today. And thank you so much for joining us. It's been a pleasure. And as always, please stay tuned every Wednesday for these weekly sessions. For the recording of this session, we'll have that on the Multicultural Health Communication Service website. On behalf of the Ministry of Health, Multicultural New South Wales, and our service, we thank you. We hope you stay safe, take care, and we'll see you again next week.